Welcome back, everyone, to Great Day, Louisiana. You know, earlier this month, we showcased Bridge House, which is the male facility that helps people on their road to recovery. But on top of Bridge House, there is also Grace House, which helps women on their road to recovery. I'm actually standing outside of the property right now, and joining me now to talk more about the services they offer here is Veronica Bucola. She is the Executive Director of Clinical Services here at Bridge House, Grace House. Welcome back.
Thanks, Malik.
Thanks so much for having me here. We're out here in Algiers today, which is where the Grace House is. Please, for people who do not know, please explain a little bit about the program here at Grace House.
Sure. So we are a long-term substance abuse, gender-specific treatment center for women, one of the only in the greater New Orleans area. We service women 18 and up, and we focus on issues specific to our women. So it's nice for them to kind of be out here in Algiers, away from the city, around other women who are dealing with some of the same things that they're dealing with.
And that's so cool that you all are building that community. There are 5 different buildings here that services these women. Let's talk a little bit about the program. It's 4 different phases that the women go through when they come through the program, right?
Yeah, so the first phase they come in, they're on stabilization for their first 30 days. They're in groups, they're getting individual sessions, we're helping them with case management, getting them to doctor's appointments. The second phase, they get a job inside the house. So this is really where a lot of the work happens, where they're focusing on some of those soft and hard skills for job development. Once they're a little further along in the program and they transition to our third phase, we start working on resumes and preparing them for getting out into the community and searching for jobs. And then they go into the fourth phase where they actually secure employment and they start working in the community and making money. We help them save money, and then they transition to sober living or to a safe place, and then hopefully come back as alumni and work with Our Lady's sponsors.
I think that's so amazing. I want to talk a little bit about the alumni because you all have been helping people for over 60 years now. Talk a little bit about the alumni and people who have successfully gone through this program.
Yeah, so we have women that complete our program and they continuously come back and they serve as sponsors, helping some of the girls that are here go through the steps just like they had a sponsor. They'll come back for our chip nights, which is where we celebrate their sobriety and how long they've been sober. We have talent night. And then a lot of alumni will come back as well and lead big book studies or help our girls if they're struggling with things that they struggled through when they were going through treatment.
I think that's so amazing. And I love how you're mentioning different events that you all have because some people may see the movies, they see the TV shows, and they think that when someone goes into recovery, it's, blank walls, no access to anything. You all throw different events. I see a basketball court. You all have a volleyball court. What are some of the other cool things that you all do here with the residents?
So yes, we encourage that they get out and they have Fresh Air Friday on the basketball court, the volleyball court. We do chip night each month where we celebrate their sobriety. Coming up at the end of this month, we'll have a Christmas party. So lots of good food, some gifts for the ladies. We do a lot of art activities, we do music therapy, we have volunteers that come in and do yoga with them. So there's a lot of things to keep them active and, having sober fun.
That is absolutely cool. And do you all let them have jobs working here while they're going through treatment?
Yeah, so they work at the front desk, we have people in the laundry, they cook their own food. And so again, that's kind of where they focus on those soft and hard skills before they transition to the community.
And it's amazing that you all are offering all of this at no cost. So whether you are homeless, Medicare, Medicaid, or have nothing at all, you all can help these women.
That's correct.
I think that's so cool. Now, in order for people to come here, they need to identify that they do have a problem. If someone is out there, or maybe they know somebody who needs treatment, what is some advice that you can tell them or their family member to help them say, you need to come to Grace House?
Reach out to us, give it a shot. If you're not sure, it's not gonna hurt for you to come and give it a shot to get sober. Everybody here is dealing with very similar issues, and when having that support around you makes going through recovery just that much easier.
So true. And what types of substances? We mainly work with people who are addicted to substances.
Their primary diagnosis has to be substance abuse, and we see women with opioid substance abuse, alcoholism, the whole 9 yards.
So many different options. And again, Veronica, thank you so much for helping out these people. So great here at Grace House. If you want more information on how you can get in contact with them, their intake number is 504-821-7120. They are also always looking for donations as well. Head over to bridgehouse.org to find out how you can help them continue this program. All right, everyone, stick with us. We'll be right back.